This is the all-new Community Connection. I'm your host, Jade Harrell, keeping you connected to our community. Well, St. Louis leads the state of Missouri in doctors diagnosing people with HIV and AIDS. In St. Louis, 63% of new HIV diagnoses were among African American women. We are joined today to talk about these numbers and what that means for us. I'm joined with Imani Aisha with Williams and Associates and Joan Ferguson, who is a consultant and certified instructor in community health.
Yes, Jade. My name is Joan Ferguson, and I am an advocate in the St. Louis community. But in addition to that, I have taken this cause around the world. I've had the opportunity to train women in Africa, in the Caribbean, and in the majority of the United States. And so Imani and I are committed to ensuring that we continue to let women know that they are worthy and deserving. So that's how I think of myself and my position in the community.
So we hear numbers all the time. It bothers me that St. Louis makes the grade all the time and having the worst of the worst. But this one is hitting very close to home. I want you to help me explain how and why. Let's start with you, Imani.
People should be paying attention because St. Louis leads the state of Missouri in doctors diagnosing people with HIV/AIDS. We are at 63% of people are living with HIV, new AIDS diagnosis amongst African American women here.
That's more than half. That's a significant number.
We're in a public health crisis right now. We have to raise awareness.
Yes, we do. How did we get here? Why would our numbers be so high? What is the source?
The source is prevention education. We are not, or lack thereof, prevention education. We are not, the message is not hitting. Some places not making a connection, because if people are protecting themselves from sexually transmitted diseases and infections, then in fact those numbers would be lower. But we have people that are walking around and have no idea that they are infected with chlamydia or gonorrhea, which are the two leading STDs that we have that are leading the state.
So we have high numbers with chlamydia as well and
gonorrhea. Correct.
Number one.
If we look at STDs by the number, St. Louis City ranks number 1 in chlamydia, number 1 in gonorrhea, and number 9 in syphilis. If you look at the total St. Louis metropolitan region, chlamydia is number 15, gonorrhea is 17, syphilis is 37.
Wow.
And so when we talk about how this is impacting, especially women in communities of color, we know that we not only handle the burden of just being breadwinners, mothers, taking care of the head of household. Now you add on a sexually transmitted disease that you've acquired from your husband, from your partner, or someone that you trusted.
Interesting. So there's a few things that we need to cover, and especially with it being Women's History Month. We're making history and in a way that may affect our future, that will certainly affect our future. Imani, you said that the message isn't getting out there or the message isn't being received. Let's make it plain and simple. What is the message?
The message is everyone should know their status by getting a test from a clinic, a doctor's office, or what have you. Most of these tests are free. Condom usage has to be increased. We have to talk about this thing now. We can no longer have it be a stigma. We have to have more comfortable conversations with everybody. Religious leaders, everybody is responsible for having this conversation and making a connection. People have to know their status, and the one way to know that is to take a test. If people take tests, we have resources. If you are negative, we do our best to have people remain in preventative health education. That's what we're about, trying to promote health education and disease prevention here in the city of St. Louis. If a person should have a positive status, we link the individuals to medical care. That will allow people to live longer, healthier lives. So,
add to the myth, bust this one, dispel this one, that by not knowing, I don't have a status. It seems that if I get tested, then all of a sudden I'll have a disease.
Oh no!
You would be with these numbers. We're walking around now. it's powerful that you said everyone should know their status and everyone should be having this conversation. Joan, you were going to say?
Yeah, I always say that ignorance is not bliss. What we don't know can kill us. And HIV is a totally preventable disease.
Completely.
No one has to become infected with HIV. But anyone, no matter what your color, anyone who has unprotected anal, oral, or vaginal sex with a person whose status they don't know, you're putting yourself at risk. Mm-hmm. So for the women who are listening to the radio right now, ask yourself, how many times have I had sex with a male partner whose HIV, STD status I didn't know? Mm-hmm. If you answer yes to that, you put yourself at risk.
Wow.
I know. When we bring it home like that, think back to the partners we've had in life. Mm-hmm, mm-hmm. Did we go and get tested for HIV? A lot of women say, well, I'm married. Mm-hmm. Do you know how many married women we counsel? I'd say out of 3 to 4 times that we do testing, we come across a married woman who has been infected by her husband.
Oh, wow.
And she's only had sex with him within the confines of their marriage.
So there's another point that's missing here, that there is no real safe and secure place other than knowing your status and making certain decisions. I've listened in on you in a group, and I think you deliver such a powerful training and awareness program. Let's speak a little bit about the safe place of making the decisions and speaking up for and expressing and insisting on operating in a place of knowing.
Sure. We go around town here. We provide these educational science-based interventions.
What are they called?
One intervention we have is called SISTA. Mm-hmm. The acronyms for SISTA stands for Sisters Informing Sisters on Topics About AIDS.
Lovely.
This intervention is backed by the CDC, the Centers for Disease Control, and we deliver this intervention on college campuses, targeting women 18 to 24. We have
Why specifically 18 to 24?
Well, reason why we target 18 to 24 is because that's an age group that has high numbers of infections as well. And it's at a point of letting individuals know they're at a point where they're making decisions. We're trying to enforce healthy relationships, effective communication, and knowing these different ways to prevent certain things, particularly HIV and STDs. Not only do we focus on that, we also talk about drug prevention, because those things too could have an influence on your decision making when it comes to choosing what is the best practice in terms of health.
Sure.
And let's not leave out intimate partner violence. We have a lot of women who are in relationships where they're being abused by their partners. And we always talk about physical abuse, but there's other forms of abuse, not only physical, mental, financially, isolating you from your family, coercing you into doing things that you don't want to do. So there's different terms of abuse. And so women may not recognize what those signs and symptoms are, but one of the things that we do know is in terms of prevention, we have the female condom that women can use. And so this is a condom that a woman can insert into her private parts to protect herself. It's one that you can insert into your body 8 hours prior to sexual intercourse. And so you don't have to fight with your partner. And I always tell women, if your partner is a guy who likes to, have morning sex, it's an excellent opportunity for you to protect yourself because you can prepare at night.
But either way, and I hear you say this and emphasize this, protect yourself.
Yes.
We have given over, and you talk about the burden of carrying the family, the household
income,
as well
everything. As
now the communicable diseases. But if the burden then is going to be on us, talk about that. And I hear you emphasize protecting yourself as opposed to handing that over to someone else to do. I guess there's a historic position that we're going to be protected by someone else because we're the meager or gentler or fairer sex. But clearly history shows we're not, for many reasons.
Yes.
But even here, protecting yourself.
Yes.
So I would like for us to go on and get into helping not only our young women, our women listeners, and our men get over the fact that this is an uncomfortable conversation. How do you break through this being so uncomfortable and making it practical, real, and beneficial.
We have to start talking about this just like we have other conversations. And in African American homes, many of us grew up where our discussions were around the kitchen table. You sat at the kitchen table while your mom was preparing food. You sat at the kitchen table when you were having your hair done on Saturday night so you could go to church on Sunday. And so we know this sitting around the kitchen table, just like we talk to our daughters about what's on sale, what shoes they should be wearing, what purse they should be carrying. We have to talk about how you take care of yourself and protect yourself with your partner. It starts with education. One of the things that we hear is grown men and women still referring to their genitalia as my pocketbook, as my Johnson, as my Willie. Why are we so uncomfortable with using the real terms for our body parts? We have vaginas and we have penises or peni. And so why don't we use those terms? When we talk to our young people,
what difference does that make?
If we're using those slang terms, it has a dirtiness to it. And so no one wants to talk about it. But when we talk about it in the sense of just what our bodies are medically and what the parts are, it just makes it real. We call our neck, right. Our ears, our hands. So why can't we say our vagina and our penis?
Because there has been the attachment of sexuality to it. And when it comes to sexuality, we're dealing in a whole nother arena.
Yes.
It's unfortunate because what's happening now, like you said, ignorance is not bliss. It's what we don't know is killing us. So we're here to bring about the awareness, to have the conversation and hopefully intervene. I love that you use the term intervene in a healthy relationship. Describe how that would look compared to what we're seeing happening today.
What we're seeing happening today is people are participating in activities and then coming back after the fact. That's who we are.
Not so healthy.
We emphasize that a lot in our effective communication with our youth. When we're out doing our prevention education trainings, our disease health promotions, we're always telling our youth that in a healthy relationship, that relationship starts with what's going on? Do you know your status? Can we go get a test together before the activity?
How early is that conversation? Is this when, hey, I'd like to take you out for a root beer float? By the way, do you know your status? Or is this,
This conversation should happen before any physical activity where you may come in contact with the four bodily fluids.
Yeah. Oh, so now we're getting into it. Yes. Bodily fluids. Yes. Did you say that? You actually said bodily fluids. Well, we didn't squirm.
Yeah. We only squirm when we define them.
But we don't squirm when we're swimming in them.
Not at all. Not at all.
That is the problem.
Yes.
So, body fluids, the four body fluids are
blood, semen, breast milk, and vaginal fluids.
Breast milk makes the top four. I don't even want to know.
Mother to child. Okay. That's only through mother to child transmission.
Okay.
We like to address tattoos because HIV, along with other STDs such as hepatitis, these diseases are not just sexually transmitted. For example, when we're talking about tattoos, we're talking about the blood that's in the needle, and we're also concerned about the blood that possibly be in the ink. From the ink. If the individuals that are performing this procedure are not using proper utensils that are clean and brand new or sterilized.
This is why this must be a regular conversation. If I know we don't have enough time to go into it all right now, but I really implore you guys, you're on the streets, your boots are to the ground, you're having the conversations, you're right there with everyone on a regular basis. But I implore you to come back frequently and we make this conversation real, familiar, and comfortable by having it. Before we go, Joan, if there's one thing that you could share, say you were passing somebody right now at the bus stop and you only had one sentence, one thing to share with them, what would it be today that our listeners most need to know?
You are worthy of loving and protecting yourself, regardless of who your partner is, what their job is, what their educational status is, what their economical status is. HIV is an equal opportunity disease. And anyone who has unprotected anal, oral, or vaginal sex can protect themselves by using condoms, by being in a mutually monogamous relationship with the partner who's been tested, or you can postpone own sexual activities even after you've started. We never tell women that that's a choice that they have. And so we have to love ourselves, respect ourselves, believe in ourselves enough to say, I am going to be responsible for protecting myself.
There we go. Imani?
Yes, I ditto Joan. There's nothing more I can add to that.
Then let's give out the call to action.
Yes.
This was the what I want you to know. Here's what we need you to do part.
We need you to visit us at our website. We are on our way to the 21st International AIDS Conference in Durban, South Africa, July 2016, and we need help to get there. We're sending 3 delegates, people that are here working on the grounds, living with HIV, working in the field, and advocating. We need to be represented. So you can find us at AIDS2016durbanbound.org.
Durban, Durban.
Yeah.
Find out as much as you can about this Women and Girls Day 2016 and just keep connected with this information and this conversation. Main takeaway is that HIV and AIDS is completely preventable. It doesn't have to happen.
Exactly.
Cancer, maybe. This, no. And you do have a choice. So let's make some great choices because we need you to survive. Imani Aisha, Joan Ferguson with Williams and Associates. E-Rise, shout out to you, brother, for keeping the struggle alive. We appreciate you all. All right, that's it for this week. If you have questions or comments or have something you'd like to include in the community calendar, you can leave a message on our message box at 314-333-8369, 314-333-8369. And for more information about our show or any of our guests, you can visit us online and listen to the podcasts at Spreaker.com. That's Spreaker.com. And search Community Connection with Jade Harrell. You all be blessed, do blessed, and take care.